So this one, the chapter 14, medical asepsis and infection control, the chapter name. So basically the infection control or medical or surgical asepsis, what it is with, right? So this chapter talking about the sterile technique, or we make the sterilization or free from all pathogen and their spore. So medical or surgical asepsis means sterile technique, sterile or free from all kind of pathogen and their spore, right? So let's go next here. Some terminology related to infection control. Our chapter is a infection control, we said. How we have to control the infection, right? The basic things or most important one, standard precursor are used for care of all kind of patient. Maybe a question comes in your mind, what are the mean of standard precursor we should follow to infection control, right? The standard precursor, other name is called universal precursor. So universal precursor or standard precursor are used for the care of all kind of patient or client to prevent direct contact with all body fluid. And standard precursor routinely practiced by healthcare provider, right? And standard precursor means, or universal precursor included hand washing or wearing the personal protective equipment. So hand washing or wear the personal protective equipment like masks and gloves is a part of standard or universal precursor. Use masks, eye protection, face shaded, all. Wet the ground, this one. And here I said before to go inside this chapter, you have to know some terminology related to infection control. First of all, here, microorganism. What is microorganism? So this is the microorganism, the microscopic organism that causes the disease. This is a microorganism. So when you need to make a sterile field, you have to disinfect your field. You have to sterilize your field. And also you have to use the antiseptic to make your field sterile. Maybe you can do it by heat sterilization or radiation. So microorganism, we said. Now go for the terminology pathogen. So microorganism causes the infection in the human, and they process the disease. And this is called pathology. Organism is called pathogen. Microorganism, bacteria, virus, all we said pathogen shortly. Bacteria, virus, fungi, all produce the infection in your body. This is the pathogen. Normal flora. So in our stomach contains some normal flora. They are good for the body, right? They can help to produce vitamin K. So I said normal bacterial flora, plants and animals normally found in the human bodies. So pathogen here type bacteria, virus, protozoa, fungi, and also the helminths or helminth. This is the pathogen. So when we make, because our chapter name, the infection control, means how we have to eradicate them, right? How we have to protect or prevent the spread of microorganism, spread of bacteria, virus, protozoa. So how we have to do, it should be including here in this chapter. And now go next one. You just say different kind of bacteria according to that shape. Some of the bacteria is ovoid, oval, and this is called coccus. Some of the bacteria look like the rod. It is called bacillus, rod shape. And some are the spiral or coil shape. NCLEX usually do not ask about this, but it is good if you know, right? So a question like this, a nurse is working in a laboratory, knows that bacteria that appears the red following the gram stain, are gram stain negative organism. Is it true or false? The nurse working in a laboratory knows that the bacteria that appears the red following the staining under the microscope look like red. It is called gram negative organism. True or false? If you do not know, this is okay, but read. So when bacteria stain with a dye, they are visible under the microscope in different color, different shape. According to their staining process, we said gram negative or gram positive. So now go here. The identification of coccus, bacilli, or squared one under the microscope involve using the dark purple stain called gram stain. So when it is dark purple, this is the gram positive. Those that appears either purple or blue are known as also gram positive. Those that appears the pink or red, they are gram negative. So according to their color, according to their ability to staining process, we categorized. So if they are dark purple or blue, gram positive. If they are pink or red, gram negative. And here we said different or common infection. Here bacteria that causes the common infection are bacteria, Staphylococcus aureus, Streptococcus gram-E, Staphylococcus B, Clostridium perfringens, or Clostridium difficile. This is the different bacteria name, right? And these different bacteria can cause different disease, right? So as an example, I give an example here. So like Clostridium perfringens or deficit, they are contact precursor. We need a contact precursor. So NCLEX board sometimes asks, Clostridium deficit, what type of precursor or disease it is? Contact precursor we need. So when any disease like Clostridium difficile or perfringens, if anybody or patient positive for deficit or Clostridium perfringens, always we have to wear the gloves or gown when you give them the treatment. The patient who are infected by contact precursor, we have to give them private room. And same infection has to treat it in the same infected another infection. So this is called cohorting. So do not cohort the different infection in the same room, or bad infection, we will not give the same room to share with a fresh or post-operative patient, with anyone experiencing like nausea, vomiting, diarrhea, or open wound, or chest drain infection. So infection control should be notified every time a patient with a communicable disease is seen or not admitted. So like I said, airborne disease has to share with another airborne. Droplet precursor has to share the room with another droplet. So it is very important when we assigning the room, and this is called cohorting, right? And this is the different organism bacteria name they causes the disease here, and here also different Escherichia coli, another most important organism, they are gram negative, causes the UTI, urinary tract infection, UTI, right? Escherichia coli, shortly called. So here we said Escherichia coli gram bacillus, Mycobacterium tuberculosis, most common, right? Mycobacterium tuberculosis, they causes TB, Mycobacterial pulmonary TB. So Mycobacterium TB or tuberculosis, they are airborne precursor, right? Like example, other diseases called measles, varicella, then smallpox, SARS means severe acute respiratory syndrome, like COVID-19, airborne, right? So airborne patient, what you have to know if your patient is a airborne disease like Mycobacterium tuberculosis or COVID-19, always wear N95 masks or respiratory masks you have to wear. Negative pressure inside the room, they need private room. Always you have to keep the door closed. Airborne door should be closed, but the droplet precursor or contact precursor, you do not need to close the door. They need the private room like airborne, but you should open the door. So as I told, airborne, droplet or contact all need the private room, but droplet and contact precursor can keep open the door, but airborne must close the door. Even a question sometimes come in the NCLEX board, the patient must wear the surgical masks during transport. For all patients like airborne, droplet, and contact, patient must wear the surgical masks during transport. Question maybe you can ask me, why patient need to transport? Like your patient is diagnosed by Mycobacterium TB, they must go to the medicine ward to radiological unit to examine the chest radiography to show the lesion inside the lungs. So when patient go from medicine ward to radiology ward, means patient need to transport or ambulating. When need to transport, you tell them to wear the surgical masks. Also keep in mind, if your patient is airborne or droplet, limited transport. Mean if patient do not need, then better do not move, right? The other one is called Borrelia burgdorferi. So Borrelia burgdorferi, right? The other organism transmitted through the cats, right? Especially the pregnant mother, chance of more infection by the cat. Another is called rickettsia. They cause fever, right? Rocky Mountains fever, rickettsia, Rocky Mountain fever they cause. And here we go, another herpes simplex. Herpes simplex virus. They are also contact precursor. Herpes varicella zoster. They are contact precursor. Influenza. What type of infection they are? Influenza. Right? Influenza also contact precursor. Right? And influenza, West Nile fever, West Nile, or flu. Flu is a contact precursor, flu, because this is the I mean, contact precursor, as I told, any kind of skin infection, also contact in precursor we need, like impetigo, pediculosis, scabies, diphtheria, Ebola, right? So last one in this space, West Nile. West Nile. West Nile is a virus, and they also need standard precursor or universal precursor. Another disease most common is called pneumonic plague. Pneumonic plague is the droplet precursor. Go next here. They is called the fungi. Some of the fungi causes the fungal infection, especially immunocompromised patient is called Candida albicans. Fungi infection in the mouth called Candida albicans. The person who is diagnosed by HIV/AIDS or the person who diagnosed by malignant carcinoma, they are immunocompromised. Organ transplant patient, immunocompromised. What does it mean? Means it does mean the patient immune system is not strong like you. So when the immune system are not stronger like you, easily they get attacked by the pathogen or virus. And Candida or fungi also attack them and causes Candida albicans. So now go here, another protozoa, some of the small organisms can cause very bad diarrhea, GIT problem, like Giardia lambria, right? Or Plasmodium, most common in some of the African countries or Asia. Plasmodium causes malaria, right? Mosquito is the organism transmitted the disease. Giardia lambria, they causes bad diarrhea or GIT problem, or Entamoeba histolytica, also they causes the GI problem. It's called entamoeba. It is look like amoeba, histolytica, right? Then helminths, all are pathogen, my friend. We know how to control, right? So enterovirus, like the pinworm or tinea, they call tapeworm infection, tinea. Helminths, you can see sometimes the big tooths or little tooth in the feet, the itchy and whitening. This is tinea infection. And now go the here links the chain of infection, right? Chain of infection. So if you know how to cut up the chain, means you break down the chain, you stop, protect or prevent the spread of microorganism, right? And when or if you know how to prevent or cut the chain of infection, that times you can stop the prevention of the disease, right? The chain of infection, basically, we said the infectious agent or causative organism, the organism what causes the disease, the organism they cause the disease called underlying cause or causative organism. The chain of infection, the first step is the causative agents like bacteria or any toxin. Sometimes the bacteria attack the like human or animal, we call reservoir. Example, human, soil, or any other animal. Then they transmit to the other, is called reservoir, right? From the reservoir, they transmit it through the blood or respiratory tract. This is called portal of exit. So someone is infected by COVID-19, then sneezing suddenly and breathing, coughing, and passing to the environment is called portal of exit. Portal of exit. So mode of transmission means like you contact with the person who have the COVID-19. So when you contact, you get it, right? And this is mode of transmission. So mode of transmission, example, the contact or droplet. Last one, the portal of entry. So portal of entry means how the bacteria enter the new host and the host is called susceptible host to person. So the chain of infection started by causative agent, then reservoir, then port of exit, then mode of transmission, and port of entry, and susceptible host, right? So now we said, like here, port of entry here. Not only this, there are some risk factor. There are some risk factor also can cause the infection spread. The risk factor means the immunocompromised immunity or chronic or acute disease, poor personal and hand hygiene. If you do not know how to wash the hand, so poor hand washing, also the chance of infection spreading. As I told, the poor hand hygiene, right? So mean your client do not use the soap or water, means do not use, means they does not maintain the standard way of hand washing. So simple hand washing with antimicrobial soap and water or alcohol based product for this, I mean, they can prevent this bad pathogen, right? Like hand are visible to swell. Before eating, we should wash the hand. After using the restroom, we have to wash our hand. After contact with the blood fluid, we have to wash the hand. And Plex board asks a easy question. Before touch your patient, you have to wash your hand. After finish your procedure or touching the patient, you have to wash your hand. So before and after both cases, you have to wash the hand. So washing hand, how long you have to wash? 15 to 20 seconds and dry with a clean paper towel. So before hand washing, you must make sure everything is prepared, like clean paper towel, right? When you go for alcohol-based product, use 3 to 5 ml of product is good to use. Also, rub continuously until hand are dry if you use the alcohol-based product, right? So as I told you, the risk factor is an important factor of infection. It is immunocompromised immunity or chronic or acute disease, poor personal or hand hygiene, or I said the IV drug user is a risk, another risk under the threat of infection, unprotected sex for sexual transmitted disease, or poor sanitation, right? So improve the sanitation system is the primary protection, primary prevention of the disease. Using the barrier condom during the have sex, it is the primary protection, primary prevention of the disease. Wear the helmet when your baby driving the bicycle or tricycle, primary prevention of the disease. Like you have a family history of hypertension, family history of diabetes, you have a chance of diabetes, you go for the scanning or testing, secondary prevention. Once you are diagnosed the disease and you taking the medication, means you want to prevent the disease, and this is the tertiary prevention, right? Super important for your NCLEX board, super important. So now go next page here. What said? Type of infection again. Healthcare associated infection. Healthcare associated. So you are okay at home, but when you go to hospital for like measurement of blood pressure, but if they do not know how to deal with you and you get infected from hospital, this is called healthcare associated infection or hospital acquired infection, right? Hospital acquired infection. And also primary or secondary infection or localized or systemic infection. So I said like here, the systemic infection. Before to systemic infection, I want to share something with you. When anybody is get attacked by pathogen, pathogen take time to produce the disease, and the time take the produce the disease, this is called incubation period. Incubation. So incubation, my time from when pathogen enter the body until the first symptom appears. Like today, I am attacked by like flu, but it takes time to sign and symptom to produce. And this is called incubation period. Another terminology is called prodromal stage, means the time from the onset of general symptom like malaise, fatigue to specific symptoms. illness stage, time when a specific symptom occur. Last terminology we use to explain the systemic or local infection is called convalescence period. Means the time when the symptom disappear to complete recovery is called convalescence period. So come back in this PowerPoint, we said systemic infection or localized infection. So systemic infection means symptom including fever, chill, malaise, fatigue, or increase the respiratory rate, increase the pulses, is called systemic infection. Another terminology is called localized. Localized means symptom include in particular location, like develop edema, pain, erythema, particular area, not transmitted from one part to other part of the body through the blood, right? So when any patient is infected by infection, when your doctor or RN give you the laboratory test, you can see the WBC count always will go up. So when infection is attack you, your WBC will go up. WBC means white blood cell go up. White blood cell usually more than 10,000. ESR means ESR, erythrocyte sedimentation rate will go up more than 20. CRP, C for C-reactive protein will go up more than 3. Also positive culture result. So when a patient is get infected, all would be the positive like this. And now go here, what next? The defense mechanism. When anybody is attacked by the organism or pathogen, our body has a own defense mechanism. Like first difference is your intragumentary or skin. Your intact skin can protect the bacteria. Also skin can produce some chemical, also they kill bacteria or virus. Then mucous membrane, also gastrointestinal system like stomach can produce very strong acid. This acid can kill the bacteria, get inside with the food. They can kill, right? The strong hydrochloric acid produced by the stomach can kill the bacteria. The bacteria go inside with the food. So they are protective mechanism. Like secondary defense mechanism, again the pathogen or infection are our body inflammatory process. So inflammatory process means when pathogen attack, the body can produce anti-pathogen, other name is called antigen. But when antigen enter the body, and body can produce antibody, antigen antibody reaction occur, right? So definitely when bacteria enter the body, first organism, I mean cell come to defense. This is called neutrophil. Neutrophil is the one of the element of white blood cell. So WBC has a defense mechanism. So WBC, especially neutrophil, come and fight with bacteria. Why neutrophil come first? Because neutrophil has a number is more, and also neutrophil can motile, they can walk, okay, they can move. Neutrophil, if neutrophil is not enough to kill the bacteria, then come macrophage, another cell. And also body has a immunoglobulin cell, T cell, B cell, they can produce antibody, and the body try to kill the pathogen. When your own body system are not enough to kill the pathogen or bacteria, that times we has to go to the doctor office, and doctor prescribe antibiotic or antiviral medication, right? And kill the bacteria. So when body is react with the pathogen, inflammatory reaction occur, and in sign and symptom produced in the body, and like increase the temperature, increase the redness, swelling, all of the sign of inflammatory process. So when bacteria attack, your body temperature go up like fever, but your body try to kill bacteria, but temperature go up. Another system of the body is called complementary cascade. This is one of the complicated system, antigen antibody, and the antigen antibody reaction, and they can produce the complementary protein and make a chain and attack the cell membrane of bacteria. All of the system is called complementary cascade, right? This is the defense mechanism here. And now go immune cell who participate in the body. One of the cell is called B cell, T cell. So they are immune cell, B cell or B lymphocyte or T lymphocyte. So lymphocyte found in the lymph node. So lymph node is a special tissue in the body. They can produce lymphocyte, and lymphocyte produce antibody. Lymphocyte produce immunoglobulin, and they are immune cell, protect your body from infection. Also signal phagocyte to destroy. So neutrophil or macrophage has a system to kill the bacteria or virus. This system is called phagocytotic system, and have a major role in antigen antibody response by B cell and T cell. Now here go factor affecting body defense against the infection. One is factor affecting. What are the important factor like age. So extreme young or extreme old person, immune system is not strong like you. So they are always under threat, under the risk to get catch up by infection. So aging is play an important role of infection. Chemical exposure, chronic illness. Chronic illness basically reduce your immune system, lack of exercise. So if you do not do exercise, your body reduce the immune protective activities. Lack of rest, all the time day you work at the daytime, the night time you has to sleep, but you are using social media. The time you have to sleep, but you have using mobile. But basically at the morning you has to go to the office, so you did not sleep, but your body every day, every night need 6 to 7 hours sleep. So if anybody does not sleep, does not take rest, immune system will be impaired. Increase the stress. So stress also impaired your immune system. So you have to know how to control the stress. Also non-intact skin. So as we know, the skin is a protective mechanism. Poor nutrition. So good nutrition can prevent some infection. Like immunocompromised patient or HIV patient, you have to give them a special nutrition, and nutrition boosts up their immune system. Go next. Here Center of Medicare and Medicaid Service. Medicare and Medicaid Service have now associated to pay for any cost related to the 3 common hospital acquired infection. Who they are? So first of all, catheter associated infection. So you know some patient has to need to put the catheter, like anybody has retention of urine. When retention of urine after certain period, pain start to the lower end and develop the pain. So to reduce the pain, we have to put the catheter. If any patient go for any surgical operation, doctor decided to give the anesthesia. That time we have to give them catheter. And catheter associated infection. So if anybody get infection because of catheter, this is called catheter associated infection, but hospital has to pay for this. Infection in blood due to central vascular line. So if anybody has to need PICA line or central line or peripheral line, if it is infected, government has to pay. Infection in the chest incision after open heart surgery, also government has to pay. And now go for here the standard precursor, or we said universal precursor, right? Standard precursor means the group of safety measure performed to prevent the transmission of pathogen found in the blood and bloodstream this is can prevent the disease, right? Or can prevent the infection. Also including the performing the hygiene here, performing the hygiene state, or wearing the appropriate protection and also exposure is possible to using the cuff put in the muscle. So I mean the cuff muscle we use if anything. So standard precursor always we has to maintaining if patient have any, I mean, we have to prevent the disease by using the standard precursor, right? And standard precursor, other name is called universal precursor here. So now, group of safety measures performed to prevent the transmission of pathogen. How we have to do this? Just washing hand, wearing the gloves, wearing the gown, and you by appropriate protective equipment can prevent to explore you to the organism. Now go a question here. A nurse caring for a patient with TB or tuberculosis is the airborne precursor. Use the transmission-based precursor. Which of the following would be used for this patient? Gown, eye protection, masks, gloves, all of above, right? All of above you must wear because the airborne basically we have to wear N95 particular respiratory masks. We have to need negative pressure, private room, right? So go here, all above. The nurse should put a fit tested N95 or a higher respirator when entering the room. The patient must be placed in an airborne infection isolation room with a negative pressure, and the nurse must use standard precursor. Go next here. So protective equipment used with a standard precursor. What are the protective equipment we have to wear? Here, basically, gloves, gown, masks, eye protection, face shaded. When the risk of contact because with the blood and body fluid is present, we must wear the star. So as I told you, in case of the direct or contact precursor, contact with the client skin or indirect means contact with the contaminated surface. So always we have to don the personal protective equipment and using the correct consequence. Like you have to wear first gown, then you have to wear the masks, then or mask or respirator, then you have to wear the goggles, and then gloves. When time will come to remove the personal protective equipment, the remove personal protective equipment using the correct technique as well. Like you have to remove the gloves first, then you have to remove the goggles or face shaded, then you have to remove the gown, then remove the masks, right? And do not touch anything. You do not touch anything in the environment after hand washing. Limit the transport of patient. Also, dedicate use of patient care equipment to their patient only, right? So this is the equipment we have to wear. Go here something, some note. Let me read. So prevent the spread of known infection to the patient or healthcare staff. Used when a patient has a communicable illness spreading through the contact, respiratory droplet, or other air. Gown, gloves, masks, eye protection, possible head cover are used for protection as appropriate. Transmission-based precursors are always used in addition to standard precursor. Here, a nurse using surgical asepsis performing hand hygiene. So surgical asepsis means it is a sterile technique, and we have to free from all kind of pathogen and their spore. A nurse using surgical asepsis when performing hand hygiene. True or false? Go and read what they talking. The term medical asepsis referred to participate perform to prevent the spread of infection. And this practice or technique include perform hand hygiene, maintaining a clean patient environment, and using the standard precursor and using the transmission-based precursor when necessary. And now go some technique perform in medical asepsis. One is a hand hygiene, what I told you before, hand hygiene. Here, hand hygiene, maintain a clean patient environment using standard precursor, using transmission-based precursor when necessary, right? So hand hygiene, super important. I told you something. Hand washing, how long? 15 to 20 seconds, right? We have to use the soap and water. Then surgical asepsis, we told the sterile technique and maintaining a sterile environment such as the found in opening room. And we make sure it is free from all kind of pathogen and their spore. Sterile technique, another one, sterile technique, performing procedure in such a way that no pathogen will enter the patient body when inserting the tubes or giving the injection. Is called the sterile technique, right? Sterile technique, sometimes disinfection means destruction of pathogen. Sterilization means destruction of all pathogen. Antiseptic, also the system, the chemical we use to inhibit the microbial growth. Also, you use the heat sterilization or radiation. Now go here, the nursing consideration or responsibilities. They keep the room clear and free from clutter, put away unused or unneeded items, and keep the needed items close at hand for the patient. Empty the urinal, bedpan, bedside commode immediately after use. So as a RN, you have to know, keep the environment odor-free and pleasant. Now go here, when use the hand washing, what need to know, after touching the blood, body fluid, or secretion, excretion, or contaminated items, right? Always wash the hand. Immediate after removing the gloves, we have to wash the hand. Also, entering the patient room, you should wash the hand. Between caring for two patients in the same room, you have washing the hand. Now go here, when to use the hand hygiene. So hand hygiene, when arriving on nursing unit, we has to wash the hand. After returning to the nursing unit from break or meal, you have to wash. After using the restroom, you must hand wash. Anytime your hands are visible, dirty, soiled, you have to wash. Now go for caring the patient who are isolated, right? Caring for the patient in isolation, spread the time taking with the patient while you are in the room. Ask the patient if you are bring him or her anything to pass. Avoid experiencing distance regarding the patient diagnosis, or remember that the patient is a person first and then diagnosis the secondary to his or her human needs. Now go for some basic talk about the system. So information in connecting feature. So as a RN, when we work, we have to take the patient history. When you take the patient sign and symptom, a good history taking can help you for diagnose the patient. So your skill or clinical connection, everything based on your knowledge. And your knowledge based on when you go to the school, nursing school, how much time you spend for anatomy and physiology. After your history taking, you make a diagnosis of the patient. This is called nursing diagnosis. After that, you decide this laboratory test patient should do. After laboratory test or diagnostic test, we have to find out what are the positive findings. After diagnosed by the healthcare provider, then we have to go to supervision, review, planning for the treatment. After planning, you has to delegate who take care of whom. Or the patient who is very critical, you give them most experienced RN. What are the LPN due responsibilities is called delegating. The time will come and patient will discharge from the hospital. Before discharge, you have to write a note, discharge note. During or after, you should educate them. This is called patient teaching. Always RN has to do this, not a LPN, not a CNA. And also, you have to do the conference, right, to see the improvement of the patient. Is called evaluate your patient. Why you have to go for the evaluation? To improve the quality of services. When you put and give the quality and you see this is good or bad, and you have what is good, you have to practice. And this one is called evidence-based knowledge, right? So post-conference or evidence-based knowledge actually improve our services, right? So now go for information and safety feature. Why are particular safety feature so important that they are highlighted as safety issues, and what could happen if those safety guidelines are not allowed? I mean, infection should be spread out like pandemic, right? Breakdown, outbreaking. So infection, review the steps of the process and the skill of procedure. Make sure you understand why the steps are important. Also, what could happen if each of the steps are not followed or followed out of the water. So definitely, if you does not follow all of the water, you will not stop the spread of infection, right? So infection will spread out. So this is all is important about